Okay, so we know that if we talk about the pathogenesis behind the tumor, there are some important risk factors which are specific to the type of the tumor and obviously the location of the tumor. Plus, we know that tumorigenesis is not, it's not a focal disease, or it has multifactorial processes which are going behind this. That can be genetic mutations, that can be in the form of the inflammatory conditions, especially the chronic inflammatory reactions which are responsible for the fibrosis and persistent acute and chronic inflammations, and that is one of the pathology. And other factors, like we talk about the tumor necrotic factors, and we talk about the TP56 and P53 mutations, they can also be one of the pathology if we talk about the gallbladder cancer. So let's have a look at the risk factors for the cholangiocarcinomas. First, we'll be talking about the chronic inflammatory conditions. Now, we know that if we talk about the functional physiology of the gallbladder, we know that it's responsible for the storage of the bile. Now, there are some conditions in which the cholelithiasis, they are basically, it's a kind of a acute and a chronic process. So it can be either way. It can be a chronic inflammatory, or it can be acute on chronic. So when we talk about the chronic inflammatory reactions, we actually mean that the process of the inflammation is going, and this ongoing inflammation results in the fibrosis. And we know that whenever the cell turnover is there, and there is new formation of the cells and their fibrosis, that leads to this process of the carcinogenesis. Now, there are some important conditions when we talk about this gallbladder cancers. We know that one is the chronic cholelithiasis, the other is primary sclerosing cholangitis. So this is actually a kind of, we actually don't know the exact morphology or exact pathogenesis behind the development of a primary sclerosing cholangitis, but it's like recurrent infections with fibrosis of not only the biliary tree, but it's also involving the gallbladder as well. Now, there can be some other chronic inflammatory conditions like oriental cholangiohepatitis, and it's like, the inflammation of the liver and the inflammation of the whole of the biliary tree. That can be one of the possibility. The other condition is hepatitis C infection, but it's more commonly associated with the other, like the hepatocellular carcinoma. But it can be one of the pathology, because the CLG, which is the cirrhotic liver, so that can actually be one of the causative factor. You can see a risk factor behind the development of the CA gallbladder. Now, there are some important infections which again, if we talk about their mechanism or we talk about their pathogenesis, it still remains the same. That is the chronic inflammatory reactions, okay? So whenever there is a parasitic infection, the response of the body would be acute inflammation, and then it would be followed by the chronic inflammatory reactions, and it would end up in a fibrosis and the process of turnover of the cells, and more and more fibrosis. It's going to build up a potential, or it's going to build up a risk factor for the cholangiocarcinoma. So one of the parasitic infection is Viverrini, and this is a parasite which is not very common, but it is actually linked to the pathogenesis of the gallbladder carcinoma. The another very important and common parasitic infection is Clonaris sinensis, and this is very much common, especially when we talk about the congenital infections. This is a worm which is responsible for the congenital infections or congenital parasitic infections of the gallbladder. So other than that, the scaris is one of the causative parasitic infection behind this. The other thing which we should know and we should remember is the choledochal cyst. So these cysts are, they are, they have a potential potency, and they are prone to develop in a full-blown cancer. So it's mandatory when you're encountered with a polyp which is in the gallbladder, or you're encountered with a choledochal cyst, it's recommended that you should incise such cyst, or go for a cholecystectomy, or a partial cholecystectomy can be one of the options for these cysts, and these are more commonly in the fundus of the gallbladder. Caroli disease is, the congenital dilatation of the intrahepatic biliary channels. That is a congenital problem within the intrahepatic biliary channel. So this can be one of the, kind of a pathology which is related. Now, there are some other chemical agents which are also responsible. We know that there are some cancers which are occupational related, like we talk about the carcinomas of the lungs. And we know that most of the time they are because of the pneumoconiosis, and because there are some inhalational agents. They're responsible for the parenchymal changes, and they're responsible for fibrosis within the lung, and the pulmonary idiopathic fibrosis. They ultimately turn into carcinoma of the lung. So these chemical agents, which are actually responsible for the production of the free oxidative radicals, and sometimes they can cause mutations within the DNA. So they have a teratogenic effects, and they can cause or they can lead to the development of a cancer. So one of the chemical agent is thorium dioxide, which is also called as a thorotrast, and the other are vinyl chloride, and we know that vinyl chloride is most commonly used in a plastic in a manufacturing industries, and those people who are working, they are prone for these conditions. And plus, vinyl chloride is one of the chemical agents which are responsible for the development of hepatocellular carcinoma. Then dioxin and asbestos, post-surgical asbestosis, is also related to the carcinoma lung, and asbestosis is actually some malignant conditions of the lungs is also responsible for the asbestosis. So remember, when you talk about the risk factors of the cholangiocarcinoma, remember that we are not talking about only the CA gallbladder. These factors can also lead to the extrahepatic and the intrahepatic cholangiocarcinomas as well, like the hilar and intraductal and the periductal cancers. They can also be linked to that, especially when you talk about the parasitic infections and the chemical agents and the chronic inflammatory reactions. They can actually lead to all these pathologies and a full-blown cholangiocarcinoma. So another factor which is responsible for these cholangiocarcinoma is the biliary enteric anastomosis. There are a couple of procedures in which biliary enteric anastomosis is being made, like especially when you talk about the extensive multiple CBD stones, or there is iatrogenic bile duct injury, or sometimes there is a biliary stricture. So these strictures can be multiple, they can be malignant, or they can be benign strictures. But most commonly, if we talk about the biliary enteric anastomosis, this can actually lead to the formation of the strictures, or after the biliary enteric anastomosis, there can be fistula formation as well, and there can be some other complications. But these fistulas actually, and this anastomosis, if not full-blown, and it develops into leakage, and then stricture formation can be there, and this stricture formation can turn into a malignant stricture, and then this malignant stricture will be developed in a full-blown cholangiocarcinoma. So remember, you have to classify and categorize the type of the risk factors. Like we talk about the chronic inflammatory conditions, we talk about the parasitic infections, and we talk about some occupational chemical agents, especially the vinyl chloride and asbestosis and dioxin, which are responsible for all these conditions. And why to know the risk factors is very much important, because if the carcinoma is developed secondarily to the chemical agents, then obviously the occupational counseling and the change of the occupation should be recommended for these group of the population. And if you do not recommend this occupational change, then might be possible after a local radical resection, the patient after so many years is coming back to you and he's presenting to you with the same complaints, and there is a recurrent tumor. So you have to keep all these things in your mind when you're dealing with a cholangiocarcinoma.